Okay, welcome everyone. Hopefully you can see me and hear me clearly and you can see my slides, but if not, let us know. I'm just going to spend 15 to 20 minutes introducing the SCRAMS project, really. We've got some excellent speakers today, and as Judith said, the idea is for some brief, sharp, interesting talks with a bit of discussion at the end of each of the two sessions. So my role is really to introduce the SCRAMS network, but also I'm going to share a little bit of data that we've collected in collaboration with the Generation Scotland group in Edinburgh as well. So hopefully this talk will be of interest to everyone. The SCRAMS website is usually excellent. Today it's down because of a server being moved, but please log into SCRAMS tomorrow, where you can see all the excellent content that the group has been developing over the last 8 months. This project is funded by an engagement award from the MRC, and really it's all about getting capacity up and running to do research at scale on sleep, circadian rhythms and mental health in school settings. I probably don't need to tell many of you that sleep deprivation is a major issue for young people, for adolescents and teenagers. You will know that it's associated with worse performance at school in terms of concentration and memory, that it's related to behavioral disruptions like bullying, that young people who are sleep deprived are more likely to take risks in terms of drugs or alcohol use, as well as driving, for example. But as a psychiatrist, I guess my big interest in sleep in young people is the fact that it's closely related to anxiety and depression, both as a symptom of anxiety and depression and probably as a precipitant for worsening anxiety and depression. And we're going to hear more about all of that this morning. What was the rationale for the SCRAMS network? Well, we wanted to investigate this complex relationship between sleep and mood disorders. My background really is in investigating bipolar disorder, and it's a big clinical interest of mine as well. And sleep is so key to bipolar disorder. And bipolar disorder starts at a youngish age in adolescence usually. So that was where I came to initially. But obviously the project has expanded with time, and we're looking more broadly at different mental health outcomes. You will know that adolescence is a key developmental period for the onset of mental illness. Most mental illnesses begin in the teenage years, or at least have some kind of onset or precursor there. And as I've just mentioned, most teenagers, unfortunately, in our modern society, live day to day with sleep deprivation for various reasons, which I'm sure you can think of. A key point, however, is the fact that, sleep is a modifiable risk factor for mental illness, and there's a lot of things that can be done to facilitate healthy rhythms of sleep that will have positive effects in terms of mental health and well-being. And then a key focus for us in terms of starting up SCRAMS was the ambition to do large-scale research in schools to do some really ambitious work. But obviously we've had to walk before we can run. So the first year of SCRAMS is really about getting the network established, getting the key collaborations with schools established, and getting some feasibility data, some of which we're going to show you. SCRAMS has really built on the success of our schools health and wellbeing improvement research network, also called SHINE. SHINE is led by the University of Glasgow. It's part of a Mental Health Data Pathfinder Award from the MRC. And really SHINE over the last 18 months has been a really great success in terms of starting to establish an infrastructure for mental health research in schools in Scotland. So the SHINE network, I'm pleased to say now, contains probably almost 250 schools across the length and breadth of Scotland, from the far north to the south, concentrated where the population is in the central belt, obviously, but covering all 32 local authorities. So a really nice mix of primary and secondary schools, and a nice mix of urban and rural, as well as less and more socially deprived schools. So it's really a fantastic established network for doing research, and that's where SCRAMS has tried to capitalize on. I want to give acknowledgements to all of the people who are involved with SCRAMS just at the outset. So you'll see many institutions across the UK and Ireland are involved, universities as well as charities like Sleep Scotland, and the NHS organisations as well in London with Mike Farquhar. So we are a properly multidisciplinary effort, and even despite the lockdown restrictions, we've had some really productive meetings so far, as I hope you'll see today. So the aims of the SCRAM projects were fourfold. We wanted, as I said, to build a network for school-based sleep and mental health research. We think that's up and running. We wanted to do a lot of co-production, knowledge exchange, and public engagement work. One great example of this was a Sleep in Schools week that we delivered back in May. Now that would be May 2020, I think. And then feasibility studies to gather initial data around sleep, mood, cognitive functioning, school engagement, etc. And as you'll see, we're interested in latitude effects and seasonality effects on mood as well. So these feasibility studies will start quite soon. And of course, we want to build capacity for this being a sustainable UK-wide network of research, and that's a key point for us to think about future funding. So just to give you an example of one very small study that was done as part of the SHINE network, focused on sleep, and really asking the question of whether it was possible to get teenagers in Scotland to wear a wrist-worn actigraph, like a Fitbit, for 2 weeks continuously, and send us back the actigraph and tell us what it was like. And so this small study really found that people engaged quite well with this. Most of them had some minor discomfort or inconvenience, but in general, these were not things that we couldn't adjust for in the future. And I guess a take-home message from this is that when you objectively measure sleep duration in teenagers in Scotland, most of them are sleeping on average about 7.5 hours tonight, which obviously is a little bit low for teenagers on average. And what I thought was interesting, that the average time of sleep onset estimated from the actigraphs was almost 11 o'clock at night in the week and 11:30 at the weekends. And as a result, almost all of the pupils that we studied had social jet lag at the weekend. So, not hugely surprising data, but interesting for us in terms of getting SCRAMS data collection in this area up and running. If you have time today, or indeed tomorrow, please have a look at the Sleep Week video produced by Blairgowrie High School. This is really a fantastic 5-minute summary of the work that they did in collaboration with Sleep Scotland, as well as SCRAMS back in May of this year. I won't play it here because it never works on Zoom, but please, in your free time, have a look at that if you have an interest in that. I want to move on now to sharing some brand new data with you. And this is really thanks to the team at Generation Scotland, who many of you will know have switched their focus of data collection during the pandemic to 2 large-scale surveys. One, COVID Life, which I'm not going to talk about, and the other, Teen COVID Life, which, as the title suggests, is focused on teen experiences during the lockdown period. So I'm going to share a little bit of the Generation Scotland data with you just now, but it's very early data. We've only had it for a couple of weeks. And I want to thank, before I do so, the Generation Scotland team led by David Porteous, but also people like Archie Campbell, Robin Flagg, Chloe Fons Ritchie, etc. So it's thanks to them that we're able to show you this data just now. So what was Teen COVID Life? Well, it was a web-based survey on mobile phones mostly, from 22nd of May to 5th of July of this year, during the height of the lockdown period. And eventually over 5,000 young people aged 12 to 17 completed the survey, which was quite a lot of data in each of the survey responses. Predominantly females, 2-to-1 female to male ratio, which is often the case with these kind of surveys, and a really nice spread of schools across the whole of Scotland took part, and across all 32 local authorities. The data I want to show you is really, as you won't be surprised to hear, focused on mood and sleep reported by teenagers during the pandemic. So we have a complete data set on 4,462 young people, a ratio of 2-to-1 females. And what I'm going to show you is the WHO-5 Wellbeing Index scores, which is a measure of well-being as well as a screener for depression, and also scores on the short adolescent sleep wake scale. Unsurprisingly, there was a correlation between a higher score on well-being and better sleep quality as measured by the ASWS. And this correlation was stronger for girls than it was for boys. So the WHO Wellbeing Index is a very well validated screening tool in young people that has a very simple format, 5 questions, focused on the preceding 2 weeks. I felt cheerful, calm, active, fresh, invigorated, etc. The top score is 100, but a screening score of less than 50 suggests further investigation for low mood, and a score of less than 29 suggests further investigation for a risk of major depression. So these are the findings from Teen COVID Life. As you can see, for the total sample, on average, the score was less than 50, which I guess is quite a low score probably in this group of young people, and probably related to the pandemic. But what's perhaps more striking is the fact that boys tended to do better than girls in terms of their self-reported well-being. So there's a significant difference obviously between boys and girls there. If we look at that in a bit more detail, and if we divide it up into those who screened positive for low mood and those who screened positive for risk of depression, again, what we find is that almost 30% of the whole sample screened positive for low mood, and a further additional 30% almost of the whole sample screened positive for risk of depression. So these are quite high screening results, I think. But what's even more noticeable and perhaps more interesting is the fact that girls tend to do worse than boys in both of these categories. So more girls than boys screen positive for low mood, and more girls than boys screen positive for risk of depression. So quite striking results from, you know, quite a large sample of teenagers in Scotland. Moving on to the short adolescent sleep-wake scale. I won't read all of this out, but this is a scale that measures sleep quality. It's self-reported during the preceding month, and it gives 3 areas of sleep: going to sleep, maintaining sleep, and being refreshed and waking up from sleep. So what are the results for sleep quality in the Teen COVID Life sample? Here we have the whole sample. That's the mean score. And again, striking as with the depression is the fact that on average, girls seem to do worse in terms of self-reported sleep quality than boys, and quite significantly worse. If we divide it up into those 3 different subscales of the sleep quality questionnaire, we see that for going to bed, girls and boys were similar, but again, girls worse in terms of getting off to, or maintaining their sleep at night, and boys slightly better in terms of waking up in the morning. So some interesting sex differences, I think, between teenage boys and teenage girls, both in terms of depression and in terms of sleep. A little bit further into that, this is just dividing up those 3 groups into the healthy people who scored above threshold on the WHO-5, those who screened positive for low mood, and those who screened positive for risk of depression. And I guess what this demonstrates is that correlation in terms of sleep quality scores being lower across these 3 groups. That's just to illustrate that correlation a bit more clearly. So tentatively, to conclude from Teen COVID Life data, is that both well-being and mood and sleep quality were significant issues during the COVID restrictions for Scottish teenagers. Clearly, sleep quality and mood are related in complex ways. You know, there's obviously a chicken and egg situation here, and there's obviously important interplay of socio-demographics and social media, etc., etc. And as we go into these data more fully, we will report that when we publish the findings. Girls seem to have more issues with mood and sleep than boys, as I've demonstrated, and that's something to think about. So I wanted to keep my talk relatively brief so that we have time to go on to the other talks. But tomorrow, please have a look at our SCRAMS website where you can see a lot of the work that we're currently doing and a lot of the work that we're planning to do in the future. I'm going to finish up by saying thanks to Judith for organising this. She's the project manager for SHINE and SCRAMS. Thanks to all the SCRAMS co-investigators, many of whom are listening. Thanks to the SHINE team and schools, pupils and parents, as well as Generation Scotland for the Teen COVID Life data, Joey Ward and Cara Wilson for the data analysis, and for our funders noted there as well. So I'll stop there. I'm happy to take a couple of questions over the next 5 minutes before we go on to the next speaker.